All right. All right, I'm going to start. All right, this is exciting. Welcome everyone, and thanks for joining the Motivate Program live teaching session. My name, for those of you that haven't met me, is Denise O'Connell, and I am the Senior Program Manager for Lender Deneen. And presenting with us today is Dr. Lenny Brennan. Dr. Brennan is a dentist from Southern Maine who's really devoted his whole career to dentistry, but most importantly to the care of older adults. Dr. Brennan serves on our Motivate Advisory Committee. He really was the inspiration behind this program, and he's known all over the country for his work. So we're grateful to Lenny being here, and also we have Nancy Foster, who is a professor at the University of Maine at Augusta, Bangor Dental Hygiene Program, and Nancy is also an advisor to us and has brought us two outstanding senior dental hygiene students today. And those individuals are Nicole Hansen and Liz Carrier, and they're going to be doing some teaching today. So we are grateful to them for joining us. And in the wings, of course, we have our producer and wizard, Samantha Knox, who is handling all of the behind the scenes stuff. She's going to manage our slides. She's going to look at the chat and manage all of that. So we are grateful to her for her work. And she also ordered your pizza. So thank you. We want to thank you for making the time today. We know you've been out there on the front lines caring for people despite COVID, and we are grateful and appreciate what you do. We thank you in advance for being understanding, because this is the first time we've ever done Motivate virtually. This is truly a pilot. Before we begin though, I just want to invite everyone to be fully present today. With COVID, most of us are under considerable stress, but with virtual learning can come some more stress. For some of us, this is new. So I invite you to leave your phone alone, leave the email alone, and just be present for our 90 minutes together. I'm standing up, so some of you may want to get up and move around. But before we start, I'd just like you to take a couple deep breaths with me and maybe do some stretching. So if you wouldn't mind, let's just take a couple deep breaths in your nose and out your mouth, and I will do it with you. You may want to close your eyes. And if you've been on a computer all day or providing patient care, you might find it helpful to just stretch a little bit and just get us centered. And of course, let's remember why we gathered today and the difference that this all makes for the care of your residents. Next slide, please.
I just all right. Transition. Sorry, we're going to go right into the slide now. And this is the patients that we were thanking you for.
All right, so I'm not able to see right now, Samantha. Are you on the how to participate slide?
Yep, I apologize.
Right.
No, just a second. I just need to bring Zoom back up. Sorry about that.
That's okay, it's a pilot. All right, so here we go.
All right, thanks for the patience.
That's okay. So how to participate. Some of you received emails and a video from Samantha on how to participate today. Matthew let us know that you've been holding quite a few Zoom meetings, so we feel like we're at an advantage today. But we hope that was helpful. Because our group is small today, we want to give you a few options to participate to really encourage as much back and forth as possible. So although you're muted right now, I invite you to unmute the old-fashioned way if you have a question that you want to bring up throughout the program today. Otherwise, please keep yourself muted. You can also use the chat feature, and that will go to Nancy or to Samantha, so no one else will see your question. So those two ways to communicate. And for those of you in the group room, we ask that if folks don't want to speak, if you could choose a scribe to send us the questions that have come up in the room, as well as the list of people that are there for attendance purposes. And we'll try this approach, and if it's too distracting, we'll override everybody and mute everyone and just use chat. But we think it's a small group and it could work this way. Next slide, please. So there is your team. In a second, you're going to see a pop-up on the screen enabling you to participate in 2 poll questions. We really just want to get you thinking and get the juices rolling. So pneumonia, most of you know, is very common in long-term care. It is also the most common hospital-acquired infection in the United States and fatal often, and more so for older adults. And a single episode can cost up to $40,000. And oral care is one of the interventions that's recommended to prevent these infections. So your first question is, a recent hospital study included providing patients in the hospital with toothbrushes and instructions to brush twice a day. When they compared the data before the intervention to after the intervention, the pneumonia rates went down. By what percentage do you imagine that the rates fell? So please try to answer question 1. And we'll see the results together. Okay, so in the interest of time, I'm going to tell you the answer to number 1 is actually D, 70%. Isn't that amazing? So you guys did well, but now you know oral health does work. Number 2, after the Motivate program, you will have received more oral health education than most physicians in their healthcare training. True or false?
Like true.
We actually had everybody answer that one already.
Can you bring it back up, or is it too late?
Can you see on the screen? It should say that we had 100% answer true.
Okay, thank you. I wasn't able to see that. Thank you so much. Next slide.
Yeah.
Great, so you know, so from the poll questions, you can see that oral health care works, and you actually are better equipped than most physicians on oral health. So we're off to a great start. So let's begin. So here's our debate, and really a concept is really what do we want to achieve by bringing a program like this to your home. So I'd like you to take a moment to read it to yourself. Is there any volunteer that would dare to take a stab at paraphrasing this and telling us what that means in a few words? And Samantha, I'm not able to see what's coming in, so I'm going to ask if any chats came in. If not, I will paraphrase.
We do not have any chats in yet. So if anybody would like to unmute themselves, they can, or send in a chat to me or Denise.
All right, in the interest of time, I'm going to do this for you. So really, what we're intending to do is educate health professionals in long-term care to work as a team, but also to elevate oral health to equal importance of all aspects of health to provide the best care possible for older adults. So why oral health, why older adults, and why in a nursing home? What you know from the modules is there are oral health disparities for older adults, meaning their care and our care differs for multiple reasons, and you learned this in your modules. And the most vulnerable and the most at risk of dental disease reside in nursing homes, particularly those with dementia. And then lastly, the evidence tells us that programs like Motivate, easily actionable, low cost, low risk, really, along with specialized education, make a difference. So with this program, you have the opportunity to change the story for your residents. Next slide. Most of us agree now that oral health does matter through your education, but some of us still say there are too many barriers. Not enough dentists, no insurance, so why bother? So start where you are, use what you have, and do what you can. This is a quote from Arthur Ashe, who is a very famous tennis professional, and he really did that with every barrier that he faced. He was a man of many firsts, the first African-American to win major tennis tournaments, but he was also a tireless campaigner for civil rights and racial equality. Unfortunately, in the 80s, he got sick during the AIDS epidemic. He had a heart surgery, contracted AIDS, and he didn't really stop. That didn't hold him back. He went on to create a foundation to defeat AIDS and also one for urban health. Unfortunately, he died at age 49, but his work lives on through his foundation. So I think we can all identify hurdles that are in the way, but we all have the ability to make a difference right now. Next slide, please. Want to refresh your memory of some of the things that make Motivate unique. So it's interprofessional, and you can see here on this slide, everyone on your team has a role, and you know that from Module 1. Is there anyone missing on the team that we forgot on this slide? This was originally vetted by our main Veterans Home team. You don't want to miss anyone. And on the Motivate committee, we had an interprofessional team, as you see here. Next slide, please. The 24/7 online on-demand modules make this unique. We looked everywhere for programs like this, and they were either too old, too long, or not interprofessional. Next slide, please. We provide live teaching, and typically these are done in person. This is our first time virtual, but that allows you front and center access to dental experts and an opportunity to ask questions and apply what you've learned. And then we also evaluate the program. And our phase 1 evaluation showed people learned across disciplines, they liked the education, and they changed the way they cared for folks after applying the enhanced learning. And these are pictures of some of the folks from Maine Veterans Home. And you can see Lenny in the slide in the top left corner right after his surgery. We captured that, Lenny. Next slide, please. Another unique feature of the program is every resident will get a kit like this. And this kit was vetted by our dental experts and informed by our pilot sites. So they told us not all residents want strong mint toothpaste, so we provide fruit flavored. You told us that it's very difficult to floss, so we got floss picks with handles. So these have been sent to your home, and they'll be handed out at Go Live on the 13th. Next slide, please. And as a program participant graduate, you'll receive a pen and a bag, again at Go Live. And you are really joining a community of Motivate learners from all over the state, almost 700 strong. So we congratulate you. Next slide, please. And here's how it all fits together. Education and training, on-site support, access to dental experts. And for that center strategy, practice support, your oral health committee and champions have met with us every month to look at guidelines and systems and best practices, and they've recommended changes that you'll be making at your home to really enhance care. And they've done a fantastic job of doing this. So next slide, please. We thank them, and there they are. So Matthew, Coralie, who I hope is with her son today. I know that was a special thing coming up for her. Lori,
Yes,
Heidi. Is she Matthew?
Yep, he made it.
Oh, good. I'm so glad. Harry, Christy, Matthew, Walter, Lisa, Barbara, Stacy, and Dee Dee. Really thank you for your planning. You've been engaged, reliable, dependable, efficient. You've been fun to work with. These are the people you want to go to if you have any questions. And despite COVID, you all reached 77 module completion rate, which is outstanding, and you've got new policies. I invite anyone on the champion team to say a word or two about the experience if you like.
Well, you know, not so much even an experience of my own, but something I thought was really cool to share was one of the CNAs actually spoke with me on Monday. I'm not going to put any names out there, but they had said, I've got to let you know that when I heard about this Motivate thing, I thought it was the dumbest thing I've ever heard. But I've got to tell you, after watching those modules, I'm really surprised how much I learned. I think it's a great program. So it was nice to see that huge change in that mentality.
Thank you for sharing that, Matthew. That is huge. You know, we often say we have to shift hearts and minds, right? We can't just do one. So thank you for sharing that. Anybody else? We'd love to hear. Any other champion want to share what this has been like for you?
Yeah, I would say on a personal level, I mean, I also found it educating, and as I was saying in one of our meetings, this even kind of inspired me to go out and get my own, you know, like super Philips Norelco, you know, or whatever it is, the Sonicare, you know, toothbrush and whatnot. And yeah, no, I think just seeing how that's been applied to, you know, things like our care plans and just our general, you know, awareness of the whole program, you know, in dental care is really, really improved dramatically over the last few months. I think our staff would also attest to that.
Thank you so much for sharing that. Yeah, when you shared it at a meeting, I sent that to my colleagues because it just made my day.
No, I think that's great. I mean, not only for the residents at the home, but the fact that you're taking ownership of your own oral health. I think that's exciting that you were. That's what this is all about. You know, so we'd love to hear that.
Great.
It's
I know.
a nice toothbrush, by the way, too. There's an excellent unit.
Nancy can tell you like what supplies. Thank you so much. Okay, next slide, please. So here's what we want to accomplish today. It looks like a lot, but we just kind of separated everything out. These are the learning objectives. So take a second to read them. We're going to do this through a case study. I don't think we can say enough that we know you're providing oral health care. You always have. But now you have specialized skills, knowledge, and learning to provide even better care. So this workshop is really intended to get you to work through a case study, to practice as a team, to apply what you've learned so that it sticks. Next slide, please. The next two slides are of the team roles, and I just thought I wanted to draw your attention to them. If you have the folders in front of you that we sent, you will find these in those blue folders along with the case study. Do those of you in the group room have those?
Yes, they do.
Okay, great. Thanks so much for getting those out, Matthew. But this is just a tool in there to remind you what everybody's role is, and that was in Module 1. Next slide, please. So in the case study, it's a resident scenario. It's a typical resident that you live and breathe, but there are some accompanying questions that we really want you to think through, and they're all open-ended. So I'm going to turn it over to our dental expert and Leonard Deneen Beacon and Ambassador Lenny Brennan, who will get us ready for the case study portion of the workshop. Next slide, please.
Thanks, Denise. Is that coming through okay? Can you hear me okay?
Yes.
The reason that this is such an important program, the case study does not say dental case study. It says case study. This is a medical study because it relates oral health to total health. And when you think about Motivate, I don't want you to think of this as a toothbrush study, or this isn't about toothpaste cleaning the denture. All the information that's coming out now associates oral disease, bad teeth, bad gums, to your total health. The number one healthcare issue in the last Surgeon General reports from 1988 through, number one healthcare issue in the United States, healthcare issue, not dental issue, is oral health. So we have a very important role of being able to help our residents not only have better oral health, but total health. And one of the things that Denise had just mentioned is that how much education do people get when they're in pharmacy school or dental school? How about less than 3 hours? And most of that comes from, like Nicole and Liz, from the hygienists and Nancy. That's where the education comes. So on top of this, we have one other important role in Maine, and why one of the reasons that we became involved is we have the oldest median population in the state, and our seniors cannot afford money as a rule, for dental treatment. Over 75% do not have the ability to go see a dentist. So what do we do to bring these people to health? And part of it is managing their oral health. One of the things that's happening in the American Dental Association is that just recently in 2019, many people stepped forward and said that it's almost too late to treat seniors. Think about that. In the United States, we do not have the ability to treat seniors. We can maybe manage their disease. So we are long-term care is that same role. That's why I think you're so important. When we thought about this program, a number of years ago, when we looked at how many of these were actually successful programs, they lasted somewhere between 3 months and 6 months. This program has been going on for years because of Samantha and Denise and everyone that's involved on this as a team. Also, this Motivate program is not just something that's going on in your neck of the woods or in Caribou or in Paris. This is going on around the state, but it's being recognized nationally. And I say this every time we have one of these types of programs, is that if you went to Chicago or California, they would know Motivate. And they will now know who your nursing facility is. So that's how important your role is. Now we can get to the case study. But I think that background is so important because what you do and what Liz and Nicole are doing is so incredibly important. Now, have people had time to review the case study? Have they looked at it?
I think we're reading it right now, right?
Yeah. So
I think it's okay to give folks a few minutes to read it.
Okay, great.
And then for those of you that have read the case study, don't forget to send us your oral health questions using chat. And I want to welcome Dr. Wendy Alpaugh, who I believe has just joined us. I think in the interest of time, we could probably, there we go to the next slide and let folks begin to think about some of the questions. And Lenny, we've got them flying in for you.
Oh, great. So when we look at Mrs. Davis, she really is one of a very common resident in the nursing facilities that I've been in, and one of the many hundreds and hundreds of patients. They're all very, very similar. So what types of questions come, when you think of her, what comes to mind about her symptoms? What symptoms does she have? Does anyone want to throw a few, when you see her, what is Mrs. Davis, her symptom? What is she talking about? What has she said either verbally or non-verbally that gives you some sense of what she's going through? Any suggestions?
Well, I think clearly she was in pain, and you could tell that by the fact that she wasn't eating normally.
Yes, that's great. That's wonderful. And so if somebody is in pain and not eating, a number of people may be aware of that. For instance, the CNAs, the nurses, even the people that do the physical maintenance around the building or that are cleaning the floors may be aware of some of those things. So everyone can have a bit of a role in what are her symptoms, but does she have a fever? Is there bleeding? Is there any other things that you may pull up on this person? What is one of the most important things when you're looking at background? part of it is when they come into the facility, have you taken baseline information? So if you know Mrs. Davis' background in terms of her oral health and medical health, it'll give you some idea of where she was and where she is today. So how would this baseline information help you when you're dealing with her? So she was not feeling good today, but she was feeling good yesterday. Would you relate, now that you've had the Motivate program, what she's going through today as maybe possibly different than how you look at it before you took the Motivate course? What are some of the things that you might look at now on Mrs. Davis? Well, some of the things that you might look at is one of the most common issues that you see in a nursing facility is a UTI. So Barbara Kelly also mentioned her last dental appointment. I think that's very important too. So if you have her last dental appointment on a record, you have an idea of what her motivation, what her health status is, what may have worked for her in the past, her desire to keep her teeth. And so those are very, very important when you're looking at baseline information. Anything else?
I think too, Barbara's point, knowing her last appointment, because it could be too, Dr. Brennan, access to care, because some residents may not only, some people would only go if they had pain. That was the only time they felt they were able to financially, or anxiety or fear of the dentist. So it would be interesting, like you said, to find out kind of when was her last appointment and what was it for, and if it's been a long time, kind of what the barriers were for the patient as well. I mean, the resident as well. Kind of, it brings up a lot. I think that answering that one question can follow up with lots of other interesting tidbits for trying to problem solve.
When you look at the Maine, that's a good point, Nancy, because when you look at the residents in Maine, generally, the senior population, the number one issue is finances. So if somebody is motivated and has their teeth, have been trying to maintain their teeth, and that is a resident, you have a great patient to deal with in the nursing facility. And if they don't have their dentition, have not been seeing a dentist, there's going to be extra work that's going to be put into bringing that patient to realize the importance of oral health. So that's a really good point. Good. What would it be, where would it be helpful to have baseline information documented? Now, that's a great question, because in your charts, where would it be important to put that information so that people see it? And which also brings up who needs to see it. Who should this information be shared with? When you have a patient in your facility, what are you looking at? Where are you going to find this baseline information? Is it in health history, dental history, admissions? Where would you find this information?
I think the quickest way for us to find it would be if it was in our baseline profile page where we look at, because that's where we would list like the primary care doctor and that kind of stuff. And that would be the quickest, easiest way for us to find it.
Great. That's terrific. That's excellent. Any other areas besides that? But I think it's important to have like one area where people can go to, because when you have a number of people coming in and out of an organization, people have to know where to go to get the information. It makes it much easier to treatment plan a patient. So that was terrific. Thank you very much. I'm going to that next one, Denise. What risk factors were present for developing oral health problems? This is an interesting question, because the risk factors are the factors that we see in almost all of our patients. So what was a few of the risk factors on this particular patient? And you can also throw in, if you wish, what are risk factors in other patients that you have? That may
Hydrochlorothiazide for the blood pressure, which would cause some dry mouth. For the antihistamine also cause the dry mouth, so.
That's excellent. Absolutely, because we know that seniors, 3/4 of seniors have at least one chronic disease with medication, and probably 3/4 of the ones on medication may have 4 or 5, and they all have oral health side effects. So that is a great place to look. And so when your patient population, you know that probably all of them, I would suspect, have probably at least 1 to 5 medications or more. So that is that would be definitely a risk factor. Anything else that would be a risk factor? What about function, her ability to function? What happened in her health that may impede her ability to function?
The stroke and some dementia.
Right. Now, the stroke is interesting because she had weakness in her right hand and she had a stroke. That was the hand that she brushed her teeth with. That could definitely be an issue. So those are the things that you want to put together that puzzle. She has arthritis. That's part of the puzzle. The medications, certain part of the puzzle. The other thing you want to be careful of is if you have patients on hydrochlorothiazide or any type of medication that reduces fluid levels, that they can dehydrate easier. So very, very important. All of those are important risk factors. Anything else to mention?
We have Barbara. Again, thank you, Barbara. Right dominant, right-sided CVA, that's residual. So some challenges as it relates to her being able to potentially brush her own teeth, would need some assistance, perhaps, as far as her needs. That was a good catch.
Yeah. So would you have thought about an oral health problem as a possible reason for her loss of appetite or fatigue?
I wouldn't have before I did the modules. I would have automatically gone to several other things before I'd have went to a dental abscess.
That's a really good point. And so what's the very first thing that you would look at? Would that be UTI? Is that what you?
Yeah, I mean, some kind of infection. I would have automatically thought some kind of infection, but I would not have automatically thought two, just.
So if you think differently, so when you're looking at a patient and you put oral health as part of their total health, you'll look at a patient differently. So that's terrific. Would you have thought about an oral health problem as a possible added symptom of confusion and fever?
No, not before I took the modules.
Yeah, because that's typically not where we look. And the other part of this is many seniors may not complain about sore gums or sore teeth, because many have sore gums or sore teeth, and they're not relating that to their health either. So that's a good point. Thank you. You want to go on there, Denise, to the next? Have you ever had a similar experience? A similar experience with a resident? I suspect you have.
I know, please. Why don't you come up here and say it?
So,
Yeah, please, we'd love to hear from you guys. We know that those of you in the group room are frontline.
You gonna say it?
I think we certainly have a high number of people here that want to maintain their independence, like Miss Davis. And because of that, things don't get checked probably as much as they should, or we wouldn't have any reason to.
that's a good point. And I think you're right. There's a number of residents like that. And I think one of the things that I find going into nursing facilities, you all key in on patients so well. And adding oral health to one of the tools, I think, can make an important part of the patient's health recovery. So that's terrific. You want to go on, Denise? Timing of intervention. I think this is a common question. When do you wait, and when do you act on symptoms? So now that you've taken this program, and we're looking at what we do to uncover certain types of issues that relate to oral health problems, what would you be looking at possibly to deal with these problems earlier? What could you have done on a patient who maybe you know that you have a history with, and their behavior may be slightly different? What steps could you do to identify if it is, what would you look for?
You would want to look in their mouth. So I know the flashlight in the kit would be helpful for that, you know, for each resident, so we could actually try to look inside their mouth.
That's a great point, and I think that really can make a difference because you're actually looking at potentially where the problem is. Any other clues that they have oral health problems besides actually looking in the mouth, which is wonderful?
She was only eating soft foods. She wasn't she wasn't eating her normal, and what she was eating was soft food.
Excellent, and that's one of those things that people, if they can keep track of. But what other besides those two? What questions, so let's go to this other question. What questions would have been helpful for the staff to ask Mrs. Davis when she wasn't eating? Since you brought up the eating question, if she's not eating, what questions would you have asked that might have helped you go in the oral health direction?
Just specifically why, you know, what, are you having pain?
Yes, pain. The other is if she wasn't eating, and sometimes they may not even go out to the lunch hall to eat or to socialize. They may be having some bleeding issues. They may have sharp teeth that they're biting their lips. So you can ask them. I think the first question would be, you know, pain, difficulty, taste, swelling. What might an oral exam have revealed? So you had mentioned an oral exam earlier. What would you be looking for when you opened up Mrs. Davis' mouth?
Redness, swelling, you know, obvious cavities, kind of stuff.
That's great. So that's important if you're looking in resident mouths often and cleaning their teeth, it kind of gives you a baseline of what's normal for a patient. So many times, if you're not looking in someone's mouth, it's hard to differentiate. Barbara has a great, just nonverbal clues. If you're seeing a patient eat or having something cold to drink and they're reacting or grimacing, and this is the body language, that is a really terrific way of looking at patients that may not be verbal or have dementia or just would not think of that themselves. So I think that's terrific from Wendy. Is she avoiding cleaning her own teeth, or does she flinch when you try to clean her teeth? That's terrific. And one of the things that this program hopefully will give all members of the team is that when you're cleaning the teeth, to record normal reactions and record that maybe in your charts. And if you're in that same area and you notice a difference in reaction, there's more bleeding, they won't let you clean a certain area, that there's grimacing like Barbara had just mentioned. Those things are really important things to record. I find it very difficult for many people to actually be able to go in and actually try to floss posterior teeth on seniors. But if during the course of normal care, if they're reacting to it, you want to take note of it. And one of the things that we had on this case, what's the differentiation between if this person had an issue, where would you intervene with more preventive care and care chair side? When would you be more apt to refer that patient out or to seek some type of emergency care? What would be the difference between Mrs. Davis is maybe not eating her food, and now you're in a situation you have to make a differentiation between when do I wait and see what we can do with oral health measures versus referring out or bringing in another member of the team. Any suggestions?
Well, definitely the temperature would be one, but I also think if you're having significant pain, that would be another one too.
That's excellent, and if you can add some, a lot of bleeding with that, with mouth odor increases. So those are really wonderful points, because once you start getting into things that may represent systemic infections, fever, swelling, and you compound that with, if you do an intraoral exam, you can see redness is increasing, or you see white in someone's mouth. You definitely want to be thinking more of an issue that you want to have other types of professional care brought in. But if you have a patient that, and this is, I think, typically what I may see in a nursing facility, you look in someone's mouth and the gums are red, and you brush those tissues and they bleed a little bit, or they bleed if in an area where they haven't been taken care of well, they're bleeding maybe a little bit more than that. But what about a situation like that? What would you do in a situation on a patient where you see minimal bleeding, there's a lot of hygiene problems? When would that be something that you would wait on versus referring for treatment? So typically, if you're brushing someone's teeth, and most of your residents, you're going to have some bleeding, especially in the posterior areas. If they're not reacting and there's no, extreme pain or fever, usually you can emphasize maybe preventive measures. But it all really also comes down to, if you're never sure, if there is a question in your mind, then there's always that. It's important to think referral for something like that. Because if you're not sure, it's good to bring in a dentist or a physician or some other care worker. Denise, we can go on. Who are the members of this oral health care team that were represented in this study? So who was the first person who may have identified this patient? And how would that proceed throughout the day?
Huh? It was CNA.
CNA, yes.
CNAs, yeah. Are there any other members of the team that could have contributed to the oral health status of this patient?
Fine.
You just mentioned the CNAs, but if they're not, sometimes the dietary team could easily be involved in this if they're noticing that someone's not eating and the food's going back. The pharmacy group or the physicians may also be part of this.
Our activities team is also very good at picking up on those things.
Yeah. MedTech, Barbara mentioned MedTech, which is true, and that's a good point, Barbara. Excellent. One of the things that I find also is that when people, the groups that come in and the physical plant people that will come in and they'll chat with patients and clean the rooms, many times they will have an idea if somebody is suffering because they spend so much time cleaning different parts of the facility. So everyone can have certainly a role in this. Which staff member could assist their daughter with his concerns and help pay for oral surgery procedures? So this is an interesting question. And I'd be actually interested in how you would deal with a situation like this from where you are, in your location. So how would you deal with the daughter in your facility?
The social services would be who we would refer her to try to help figure that out here.
That's a good member of the team. And what about, how do you pay for oral surgery procedures? How does that work?
I mean, that's a personal thing,
we do that program here through Wendy Alpha, but they help do dental work for like $5 here. I can't remember what it's called.
Yeah, if it's something that can be done in our facility, Dr. Alpal has a thing that we can do, but if it's something that has to be referred out for surgery, then that's a whole different thing.
Is that difficult to do? When you're
Yeah.
Is it difficult because of just getting a patient to the oral surgeon, or is it difficult to find professionals that will assist you in patient needs?
There's no way to work on them anymore.
Yeah, I think it's a lot to do with finding someone to work on them. And then the next piece is that if you find someone, a lot of times they won't get the procedure paid for in advance, becomes the next hurdle.
Which, you know, when we go back to the point of the Motivate program is hopefully that if we can prevent the decay, we'll have less issues in the long run. But that really is the dilemma. And I know here in Portland, we use volunteer services in churches and different organizations and things like that. But it really is a dilemma around the state. Wendy, what else do you do if you have a patient who needs care? How do you handle a situation like that?
Emergency room. It's the only,
Lots of phone calls.
Okay. Nancy, did you? What role could the pharmacist fill in caring for Mrs. Davis' oral healthcare needs? Why is it important to have the pharmacist at least looking at or evaluating the medications of Mrs. Davis for oral health? What's the relationship between medications and mouth care? Did you learn? What were some of the tidbits in the modules?
right, and so that goes back to the antihistamines and a lot of medications that cause dry mucosa, which would then can cause damage to the teeth.
Yeah, that's a good point, because it's almost all medications cause dry mouth and almost all medications cause taste disturbances. So that's something that people have to be very aware of when they're prescribing medications.
Dr. Brennan, I know you've presented at the school of the hygiene program and talk about how interesting that there's 700 or 800 prescription medications that cause dry mouth that are at the top of the list, one of the major side effects. But what's interesting is that I'm sure many of the residents, the data show that when you take multiple medications that cause dry mouth, exacerbates the xerostomia, the dry mouth, even more. So I know that resonated with me when I was like, you're right. That's it's challenging enough with one med, and then you add several medications that cause that. It makes it can be very difficult and of course hard to eat and chew, and of course we know through the modules the disease that can be caused, cavities and gum disease, by having long-term dry mouth. So but their medications, obviously it's balancing that, right, that they need to take.
Thank you both. I'm just looking at the time. I think we're going to need to move ahead, but what I observed just now is great participation, and you've obviously taken the modules because you're able to say, what's the CNA's role? What is the pharmacist's role? What's the social worker's role? What's the nurse's role? And then we also know dietary and housekeeping, right? If they're sometimes, it's those folks who are going to really know the resident very well and know subtle changes in how they're acting, and then would go to the nurse and say, Mrs. Davis isn't acting right, or she returned all her food on her tray, or when I went in to clean her room, she wasn't acting right. So this is fantastic. And we have one more slide, Samantha, if you could bring that one up too, please. Opportunities. And all of these things your champions have been talking with us every month about. And what's beautiful about what they've done is you are now having an oral health care plan for every resident. every quarter. And at every oral health care plan every quarter, you're going to be replacing toothbrushes. And Dr. Wendy's with us today, and another wonderful thing that your team has done is they've created a referral form when they do need a resident to see a dentist, when it's one of those things you have to act on and not wait or monitor. So Dr. Wendy gave us some input, and you all incorporated her suggestions. So really good things coming from this. So I applaud you.
I see, Dr. Alp, the chat, that some patients have been prescribed the extra strength fluoride, as well as chlorhexidine rinses. So I think that's awesome. Really, again, evidence-based, practice for, again, especially for caries, the cavities infection that people have. So I commend you, because I think some of the homes we've talked to struggle with the prescriptions for fluoride toothpastes and the rinses. So I really, that you embrace this and many of your residents are benefiting. That's fabulous, exciting.
Thank you. Thank you, everyone. Thank you, Lenny. Let's go to the next slide just so we have time to get to. All right, so the next section, and again, Lenny has offered to come to your home when it's safe, because the other benefit of the program when we typically are at locations is we bring Lenny and Nancy to your home for Go Live, and they do bedside teaching with residents. So when that's safe, we're grateful to them both for volunteering to go and do more of this good teaching with you at the bedside. But the next section is kind of new. We've always done some demonstration, but this time we have our wonderful senior dental hygiene students. We're going to go over demonstration, but also denture care. So they're going to cover this. And again, if you have questions, don't be afraid to ask as we go along. So I'm going to turn it over to Liz and Nicole.
Hey everyone, I'm Liz.
I'm Nicole.
And we put together this presentation for you guys just to show you some of the highlights and that you may have seen in your modules or may not. So we'll start off with some information here.
Go to the next slide.
Just so the audience knows that, again, these are my senior students, and they worked really hard and they were really excited to develop this presentation for your group. And again, they even came in and made YouTube videos and really tried to make it, for active participation. And again, they did a really great job, I think, and I hope that you enjoy it. And they did, again, put many hours and are very excited to be participating in this workshop with this group. So many weeks in the making. So you guys, you gals, have the floor.
Thank you.
So I'm sure you heard in your modules about aspiration pneumonia, but what is aspiration pneumonia? So aspiration pneumonia is caused by a foreign material such as food debris, saliva, biofilm that actually gets aspirated or inhaled into the lungs or airways, leading to the lungs instead of being swallowed into the esophagus. So it's getting trapped in the lungs there. And a higher number of bacteria and food debris in the oral cavity actually leads to an increased risk of aspiration pneumonia.
Next slide. Here we have a picture that will show you some commonly known bacteria that can be found on dentures if not removed during daily cleaning. So the oral cavity itself has so many different surfaces, and each can be coated with a plethora of bacteria that make up plaque biofilm. So there have been over 700 species of bacteria detected in the mouth. Some can be good and some can be bad. Next slide.
We also gathered some evidence-based research for you guys to see kind of what the research is telling us as far as why is this happening, who is it happening to. So as we've touched base on, harmful germs can lead to the aspiration pneumonia. Scientifically sound experiments have studied the effects of oral hygiene measured on the incidence of pneumonia. In one study we looked at a new pneumonia rate based on the oral hygiene measure in place. There was 417 participants from 14 different nursing homes. One group had their denture cleaned once a day or natural teeth brushed after each meal, and the other group had no oral hygiene measures in place. So kind of whatever happened in that group. And what they learned was those who had good oral hygiene had nearly 8% less new cases of pneumonia, and mechanical removal or brushing of the oral biofilm or plaque bacteria in and on the oral cavity or denture consistently reduce the pneumonia incidence in each resident.
And then we looked at a review of multiple different studies that concluded from 4 randomized controlled trials that there was 1 in 10 deaths from pneumonia that could have been prevented by just improving the overall oral hygiene. And then we just wanted to add that there are various bacteria and something called Candida albicans, which is just yeast, that can nestle into the micro cracks on dentures and actually sit there, and you might not even be able to see it.
Next slide, please.
On this slide, we just wanted to show you some different types of oral conditions that may occur as a result of bacterial overgrowth. You may have seen this before. It's candidiasis, but it's also commonly known as thrush. And then there's also stomatitis and cheilitis that can occur from bacterial overgrowth as well. So daily removal and cleaning of dentures and regular teeth can really help reduce the risk of these conditions as well as pneumonia.
Next slide, please.
I forgot.
So we're also going to touch base on not caring for natural teeth. I'm sorry, my dog is wanting to help. So we're going to go over flossing and brushing techniques. So if you could go to the next slide. I'm so sorry. He's been good until now. So
that sounds like my house, Nicole.
You want to put him on the deck for me? So this next slide is just illustrating how to use the C-shaped flossing method, which we'll also cover in our video later on. So the key component about this is you want to be really gentle when you're going in between the teeth up into the gums with the floss. You don't want to jam it up in there. I know sometimes in the rear teeth it's harder to get the floss up in there, especially if you're flossing the resident's teeth and it's not your own. It's harder to feel, but being really gentle and just wiggling it up very gently up all the way underneath the gums and then down and maintaining that C shape. We're going to be using the demonstration in the video that will be showing the ribbon floss. And I'll have you go to the next slide for me, please.
And this is called the modified BAS, and I'm not sure if you've heard of this. We were told you got some of the basics in your modules, but it's basically the most commonly recommended toothbrushing method. And what you do is you use a soft bristled brush with fluoridated toothpaste ideally, and you're going to put it at a 45-degree angle towards the gum line, and then you do a horizontal scrub and then back and forth, and then you're actually going to do a sweeping motion to sort of sweep any debris away from the teeth. And you'll also see that in our demonstration as well, but it's definitely the best method, and it's something that I just learned about a couple years ago when I started hygiene school, so not everybody knows about it. Next slide. And then this is just our kind of little funny way of showing you soft bristle brush with toothpaste, and then the wiggle, wiggle, and sweep, which you'll get a better visual of in the video. And you can go ahead and play our demo. The first one, please. Cut your head off.
It's okay. I don't think there's any sound.
We're not able to hear it. Are you?
I'm not hearing it either.
Let me try this again. I'm sorry, everyone. Let's see.
No problem.
Hi, everyone. Today we're going to cover the modified BAS brushing technique.
Is this working now?
So you're going to want to have your patient open.
Good.
So you're going to come in at a 45-degree angle towards the gum line. And you're going to just softly wiggle back and forth. And then once you loosen all that debris, you're going to sweep it up away from the gums. And you're going to repeat that all the way around and all the way around on the inside. These front teeth can be a little challenging, so you can actually tip your toothbrush down. So you're tipping down into the mouth and wiggle back and forth a little bit like that, and then sweep up in that motion. And the same goes for the top and the front, just kind of towards like that. So you're gonna wanna wrap the floss around your middle fingers so it's nice and taut. And then go down to the tooth that you're going to floss, and you're gonna wanna put it in a nice C shape. So you're gonna enter at the top very gently and wiggle down and kind of wrap it around the tooth like that, and gently move it back and forth, getting all the way down to the gum line, and then gently coming back out in the wiggling motion. You're gonna wanna keep the floss in a C shape, kind of like this, as you're going up and down on the tooth. All right, thank you.
All right, so we hope that gave you a little bit of a better idea and a visual of how both of those work. And then we're just going to continue on into some denture care do's and don'ts.
Have you go to the next slide for us, please, when you get it? There we go.
And one more, please. Thank you.
So these are the different types of dentures that you may see in your residents. A lot of it will depend on if they still have natural teeth, which is demonstrated in the bottom right with the partial dentures. They'll still have some natural teeth in there, but every person's denture appliance is different. So the one thing they all have in common though is they all need to have mechanical plaque and debris removal. So you want to make sure that you're brushing those, and we're also going to go over the steps to do that. And another thing I wanted to mention is in the bottom left corner where you see the implant supported dentures. If you are cleaning these, one thing is if you're using an interdental brush or any oral toothbrush that has any kind of metal in it, you want to refrain from doing that because it can actually scratch the little support pieces, those little metal screws that you see in there. And if it gets scratched from other metal rubbing up against it, that can also harbor bacteria and cause infection or lead to the aspiration pneumonia. So I just wanted to go ahead and mention that. Stay away from any type of metal-based oral appliance cleaners when you're dealing with the implant supported dentures. And I'll have you go to the next slide for me. Thank you.
And then here we just wanted to show you how you can keep dentures looking sparkly and clean versus ones that have been a little bit neglected and clearly have some buildup on them. Next slide, please. So this one, we wanted to show you the partials. Partials are very unique and they're individualized to each resident or patient and each person really. And plaque can get caught on the clasp really easily. So you can see the metal clasp here we have on the bottom left, plaque retained on the clasp. So that would have to be brushed because that's a natural tooth that it's holding on to. So in addition to caring for the denture themselves or the partial, you will also want to make sure that the resident is brushing and flossing those areas as well to maintain those and that not have any further, extractions or have to have a full denture. As well as 30 minutes after mealtime is ideal too to take those out. That way you can remove the food debris. And next slide. Perfect. Thank you.
So on the left, you can see the nice sparkly clean dentures, and then we found some good example photos of some dirty dentures for you guys. And you can see the arrow pointing to the bottom right denture. You can see the plaque and debris kind of built up in between the cracks. So on the denture brush, or you can use a regular toothbrush as long as you're using any type of brush really, you want to make sure that you're focusing on any kind of crevices or anywhere that can harbor any type of food, bacteria, plaque, anything like that, making sure that you get that cleaned off, because once it does harden on the surface, as you can see, it's really stuck on there in those pictures on the right. And I'll have you go to the next slide.
And then I just wanted to point out too, so you can't floss dentures. So on that last slide where the plaque had kind of calcified in between the teeth, it's really hard to remove that once it's calcified because there's no way to floss it out. So it'd have to be like professionally removed. As far as supplies for denture cleaning, pretty simple supplies. So you want a denture brush or a soft bristle toothbrush would work just fine as well. Denture cleanser tablets, you can use any brand that's available to you and just make sure you follow the manufacturer's instructions. A paper towels or a soft cloth that you have that can line the sink. A lot of things happen and it can slip. You're using gloves with a slippery denture. It can fall and actually break in the bottom of the sink. So anything that can help give that added layer of protection. And then a cup with enough water to submerge the denture or partial. That way it's fully in the water. You'll see in our video, we use like a big Ziploc baggie at the school. So you could also use that as well, whatever's available to you. And then gloves, of course. And go ahead on to the next slide, please.
And this is just a simple step on how to clean a denture. So we are going to play a video for you as well, just like the toothbrushing video, but there's the quick steps here. We're wanting to remove the denture overnight so you can let those tissues breathe. Dr. Brennan talked about the tissues getting inflamed or infected, and you really want to let your tissues breathe. It's kind of like the same thing as if you get a cut on your hand or something, you want to take the Band-Aid off and let air get to it. You want to regularly inspect the denture for any cracks or wear, because that is a big indication of needing a new denture, needing repair. Maybe it's harboring more bacteria, and those micro cracks really keep the bacteria in there, and you can't really see them as well. So you want to regularly inspect to make sure that those are comfortable for the resident. You want to brush the denture using water, or you can use denture paste. It's not required to use denture paste. Whatever you prefer, water is perfectly fine, as long as you're getting the brush in there and removing that biofilm, plaque, all that kind of stuff. After you brush, you want to rinse it with water, and then you submerge the denture into a cup of water with denture cleansing tablet, following the manufacturer instructions, which is located on the back of the box, on the side of the box. It'll be on the outside of the package. And following these steps will reduce the bacterial load on the denture and reduce any kind of bad breath that the resident might be having. And you want to make sure that you brush the metal clasps on the partials and any area that might harbor food debris, to make sure that you're getting all that bacteria off.
And I forgot, actually, on my last slide, I meant to mention, you don't want to use regular toothpaste because it can be abrasive on the denture. So no regular toothpaste, whitening toothpaste on the denture, anything like that. But you can use the denture paste like Nicole said, but it's also not necessary. Okay, and I think we're ready to play you our final demo.
Everyone, today we're going to cover the simple steps to cleaning a denture. So we have our setup here, and the first thing you do is going to retrieve the denture from the patient, and you'll just want to do a quick inspection and make sure that there's no cracks or fractures or anything that looks suspicious on there. And then we're going to line the sink with some paper towels to add a protective layer just in case it were to slip. And then you're going to go ahead and start brushing. So just some water, you don't need any toothpaste. And then go ahead and brush the denture just like you would with the modified Bass technique that we showed you in the last demonstration. And do a nice wiggle, wiggle, sweep all the way around the front and the back. And then you can also use the pointed side of the denture brush to get in between the teeth. So that will help get any food debris that's stuck in there. And then once it's brushed, you'll give it a rinse. And then we're going to put it in our bag with a denture tablet. You could use a cup or whatever you have available. Can hold the denture and submerge it in water. So once it's submerged in water, as you can see, we're going to let that sit 3 to 5 minutes. And then once it's sat there, go ahead and empty it out. And then just make sure you have a light hold on the denture as you're emptying it out. And then we're going to go ahead and give it a thorough rinse. And then that's the nice clean denture. The other thing we wanted to mention is the partials. So you clean them the exact same way. Everything is the same. You just might want to pay a little extra special attention to the clasp areas because they can really retain food and plaque. So just giving them a good extra scrub before you would go ahead with the denture tablet.
Alrighty.
All right, and that's what we had prepared for you today. So we hope you enjoyed watching.
And if you have any questions, please send it to the chat, and
we'll be happy to help answer.
Or you can unmute yourself and ask us. It's totally up to you.
I'm not sure how we're doing on time, so.
You guys did great. You said it took you about 17 minutes, and it's exactly what it took you. Woohoo! So thank you so much. I mean, you clearly, Nancy shared with us, you clearly put a lot of time and effort into this, and thank you for doing that. and for being a participant in this. You know, part of what we hope is that by doing these sorts of programs, we also connect with academia and get students excited about working with older adults. And that, and when we hope that you have an opportunity to go with us to Island Nursing Home when it's safe to do so, because
Absolutely.
this was really good. And I know we didn't get a lot of questions that came in,
Wait,
but before we, okay, great. What I was going to say, Nancy, is before we move on, we're going to go over a little bit because we started late, but that's okay. Maybe 5 minutes over, but I wanted to just open up questions to Nicole and Liz right now before we move on.
See that there was a kudos from someone in the group that it was a great presentation, and so thank you for that, guys.
Thank
So,
you.
Awesome.
Yeah.
So particularly those of you in the group room, was there anything that Nicole or Liz went over that was that you're wondering about? You want to ask any clarifying questions? We hope that was helpful to you because we know you're doing this every day.
I was just wondering, after you, like, if you were working with someone with dementia and you had taken out their dentures, but they're still scared, and you've explained it to them, how would you best, like, get their tongue specifically and their to brush their tongue and their gums?
That's
Because
definitely.
a lot of,
Oh, go ahead. Sorry.
no, I don't know what else I was gonna say. What?
It's definitely a challenging thing working with patients, especially when you've explained it and they aren't understanding what you're doing. It can be scary. Something that you can do is if you have like a handheld mirror or something, or you can place the patient in front of, or excuse me, the resident in front of the mirror, and you kind of stand beside them and they can watch as you're doing stuff as they're looking in the mirror. It kind of makes them feel like you're doing it with them versus you doing it to them. If you're, instead of being in front of them, you're kind of beside them, and it's more supportive and might be a little less scary for them.
Right.
To approach it that way.
That's a great question and a great answer, ladies, and also a nice segue into the folders that you all received. Inside those folders are many of the tools that were referenced in the modules, and a couple of them are about exactly that question. How do you best work with a resident who has dementia or cognitive challenges that doesn't want you in there? And so you'll find Mouth Care Without a Battle tool in there, and some other approaches that are based on the person's challenges. So those are going to be used by your home as boosters, education boosters, and recommend that you look at them and just maybe keep them to refresh your memory about how to do that. Before we move on, any other questions that came from that last section?
I was going to quickly piggyback on the student's answer too regarding that scenario. I think also there might be days that, because I think Alzheimer's patients or dementia patients have better days than others, and there might be a day or two that you can't do that, right? Or you only are able to get the cheeks one day or just the tongue one day, and that's totally fine, because again, every time you're in there, you're lowering that bacterial load. And so I think, or finding their best time of day. And again, I'm sure that you guys or the group is with lots of different things that you work with residents with, but same with oral health is if they're in a cooperative, it's a great day and things are going well, that's maybe your opportunity to get in as much as you can. So I know, because of some of the homes we've gone to, it's sort of like, I think sometimes people think, well, if I can't do it all, then forget it. You know, that's sort of like, we'll just not do it. And I think that the mantra and what we're learning is that, you know, something is everything. So if you can just do one little area or one tooth, that's fabulous. So I think that in Dr. Brennan, I know this is a common question that we do get from the homes that we've been in, is the challenge, the challenge. And I think that just getting in there, even if it's just for a tooth or two, or just the tongue, or is a good thing.
It's a good reminder. Good reminder, Nancy. Something is everything, and then you can work as a team to figure out, you know, how do we incorporate that into that personal care plan for the person. All right, next slide, please. So let's just take a quick look at the learning objectives just to make sure we covered everything we intended. So we, through the case study, Lenny led you through working as a team. We talked through the lecture and demonstration about best practices. The tools are in your folder. Lenny led you through when to wait, when to act, or when to monitor, when to act, and how to intervene early, and how to communicate as a team. And again, I'm just delighted that your home is going to be really applying all of this by having oral health care plans for everyone every quarter. At the end of this session, you're going to receive a link that will give you some questions that we ask each aspect of this learning, because it's our first one. And for those of you in person, we're going to ask you to fill out paper copies that we provided so that we can get your feedback and improve for the next time. Next slide, please. Just want to invite you to go to our website if you want more information. There's lots of resources there, but two of them that you may not know about. One is a resource library, and all of the education references that are in our learning modules are in there, and you can search. It's interprofessional. And then you are part of the Motivate program, the Motivate community now, and we are listed in this Administration on Aging federally funded database. So you are part of this program that's now on a federal website. Next slide, please. And again, can't say enough about incorporating the resident and the family in all that you do. And I know at Island Nursing Home, this is a really strong aspect of care, but they really need permission from you to know that it isn't normal and healthy aging to have pain or poor oral health, and for them to talk to you, and for the residents to help, and for the families to help if the residents can't. So we've sent all of these to your home, and you're going to be sending them out on admission, but also you can use them to teach. Next slide, please. And lastly, we thank you for participating. Again, you're pioneers, you really are. There's no other program like this anywhere in the country. You're joining a community. We have confidence that you're going to continue to apply your enhanced and specialized skills now to benefit your residents. And you all have a voice, from housekeeping to nursing. And remember that you can start where you are, use what you have, do what you can to unlock doors for better health for your residents. So thank you so much for your time. We know it's precious today. And so what's going to happen now is you're going to get a pop-up through chat that asks you to give us your feedback. Now, this is separate from the overall program evaluation that you'll get next month, but this is just about the workshop today. And we invite you to tell us by taking a few minutes to complete that. So I think it just came through. Please complete the evaluation on this virtual workshop, and you just click. There's only like 3 or 4 questions. Any parting words?
Denise, I have
doing it?
just one thing is to thank Dr. Wendy for the work that she does, because it's the population in rural Maine is a difficult population, and really I think what she does is incredible, and it's really important to say thank you for the work that she does, the prevention that she does. She trains the entire community, and she's been doing it for years so successfully. We know her down in Portland as well as people down east. So thanks, Dr. Wendy.
Thank you, Lenny.
Well, she comes in and teaches too in our clinic. And so Bangor, so she's, all over the state. I know, she just, we're really blessed and lucky to have her practicing here and all she does. Thank you, Dr. Alpaul.
Thank you.
And thank you for leading us to Island Nursing Home. We haven't forgotten that you let us know this was a wonderful home and people that were really committed to the best resident care. So thank you for that. Nicole, Liz, any of the champions, anybody in the meeting room, any parting words as you're filling out your evaluation? We really appreciate your time today.
I just wanted to thank everyone for coming today and allowing us to present to you guys. It was a great experience for us. I always think anytime I teach someone something, it's definitely a learning experience for myself as well. And I always learn something in the process. So thanks for including us today with your workshop. We really enjoyed it.
Yes, and I hope you learned something.
We did. Thank you both.
Can I just say one other thing, Denise? I hope we have a time sometime when this virus goes under control that we can actually come down. And because there was a great question about what do you do with an Alzheimer's patient? One of the things when we visit, what we try to do is your most challenging patients, either medically or dentally, deal with those, but not just to do it through a slide presentation, but actually to work with you chairside with your patients. So I'm hoping we have that opportunity sometime, but also with you, with the patients that are giving you the most difficulty. So maybe fingers crossed sometime in the future.
Exactly, Lenny. Maybe we can do it when we do the legacy meeting, when we go to the home and kind of provide your team with a bundle so that you can continue to take the modules as you onboard new people. So I hope that we can. Thank you, everyone. Thank you, Nancy, Lenny, Nicole, Liz, and everyone at Island Nursing Home, and Samantha. We couldn't have done it without you guys. You guys are a wonderful team. Thank you.
And thank you, Denise and Samantha, again for making this happen. Excellent job.
Don't forget to do your evaluation, please.
Thank you, everyone.
Thank you.
Thank you. Thanks, Wendy.
Thanks.
Bye.
Bye-bye.